Assalamu alaikum. Welcome to our presentation, Cost Effectiveness of Natalizumab compared with Fingolimod for Relapsing Remitting Multiple Sclerosis Treatment in Colombia. Author, Alessandro Lasalavia, Value in Health Journal, 2020, presented by Zainab Ahmed, Doaa Yousef, and Sara Basim. Presentation components include introduction, objective, method, result, conclusion, and critic. Critic means our opinion in the study. Introduction. Multiple sclerosis is a chronic autoimmune disease characterized by neuronal inflammation and axonal demyelination. Multiple sclerosis has significant economic impact on healthcare system in Colombia. Multiple sclerosis is the most costly disease in the country. Multiple sclerosis prevalence is less than 1 per 5,000 inhabitants, and the once-a-year disease costs range from $6,600 to $16,600, depends on the expanded disability status scale score. This is a standard scale score used to monitoring a patient with multiple sclerosis. Multiple sclerosis is difficult to assess because the differences in signs and symptoms between patients and variability to response. According to the expanded disability status scale score figure, we have a score range from 0 to 10. 0 mean no disease, from 1 to 4.5 mean high degree of ambulatory ability, from 5 to 9.5 mean decreased ambulatory ability, 10 mean death. Multiple sclerosis have 4 clinical variations: relapsing remitting multiple sclerosis, primary progressive multiple sclerosis, secondary progressive multiple sclerosis, and progressive relapsing multiple sclerosis. Relapsing remission multiple sclerosis includes unpredictable attacks followed by periods of remission. Primary progressive multiple sclerosis study increase in disability without attacks. Progressive relapsing multiple sclerosis, same primary progressive multiple sclerosis but with attacks. Secondary progressive multiple sclerosis initially begin with relapsing remitting, then convert to decline without period of remission. Multiple sclerosis treatment have goal. The goal to avoid relapse, to avoid progression to disability, lesion in the central nervous system, and cerebral atrophy. Treatment first line for multiple sclerosis include interferon, glutamine, triflunomide, and teriflunomide, and dimethylfumarate. Second line to treatment include natalizumab, fingolimod, and elotuzumab. Objective here is to evaluate the cost effectiveness of natalizumab compared with fingolimod for relapsing remitting multiple sclerosis in patients without appropriate response to first-line treatment in Colombia third-party payer perspective. Natalizumab is humanized monoclonal antibody. Fingolimod is immunomodulator from family of sphingosine 1-phosphate receptor modulator. The natalizumab and fingolimod work by prevent the migration of the immune cells from its site and lead to reduce the rate of relapses and increase the time of remission. This study used to evaluate these two drugs in patients that not respond to first-line treatment, as we say, glutamine, interferon, teriflunomide, and dimethylfumarate. Treatment study in Colombia in the perspective of third-party payer, not the patient and not the healthcare provider. It's from the third-party payer, include company insurance, governmental company, and others.
In this study's method section, conducting economic evaluation focused on comparing two medical interventions, natalizumab and vincolimod, for the treatment of patients with the relapse-remitting multiple sclerosis. This evaluation conducted from perspective of third-party payer. Third-party payer is referred to organization that responsible for covering the healthcare cost associated with a medical treatment or intervention. So this means are considering the cost incurred by insurance rather than individual patients. In this study, considered direct medical cost related to the treatment and management of relapse-remitting multiple sclerosis, while indirect medical costs such as loss to productivity or caregiver burden are not considered due to lack standardized method or data source for this estimation. Also consider time horizon of 5 years and discount rate of 5% is applied to both costs and utilities. Primary focus was on measuring the impact of a treatment for relapse-remitting multiple sclerosis in the term of a quality-adjusted life year, IGALI. IGALI is provide assessment for both disease progression and relapse, taking into account the disability level as measured by expanded disability status scale. For natalizumab, the study also factored in the risk of progressive multifocal leukoencephalopathy that effect on both the cost and the patient quality of the life. Similarly, for vincolimod, the analysis considered the potential cardiovascular and ophthalmological complications to provide a view of benefit and risk associated with each treatment option. About the measures, several من المeasures undertaken to evaluate the impact of a treatment for relapse-remitting multiple sclerosis include 4 measures we use in this study. The first one is relapse. The study took into account the occurrence of relapse and relapse-remitting multiple sclerosis patients at various disability stages. It's important due to significant effect on the patient quality of the life and the healthcare cost. The second one is PML risk. The progressive multifocal leukoencephalopathy are severe and life-threatening side effects of natalizumab. This assessment based on recent cohort study data. PML is a critical factor in evaluating safety and the efficacy of natalizumab. Third measure is mortality calculation. It calculates using National Administrative Department of Statistics. In this calculation is focused on a specific age group between 15 and 44 years. For example, in the worst case scenario for natalizumab, the patient who developed PML would die during the cycle in which the event is occurred. The last one is utility value, essential for patient quality of the life and overall the quality adjusted life year associated with the different treatment strategy. So the GALI is the main outcome. In this study that is use Markov model. طبعا الماركوف model يعني بكل بساطة إنه هو عبارة عن mathematic and computer framework used in various fields include healthcare, economic, engineering to analyze and predict the probability of a transition between different states or conditions over the time. The core assumption of this Markov model is the relapse-remitting multiple sclerosis. Patient can occupy different disability grades is divided by expanded disability status scale or face mortality. The interesting in this model operate is 1 year cycle, so allowing for granular examination of how patient status change annually. This approach is enable research to project long-term outcome considering factors like disease progression, relapse, and treatment effect over time. So, help the healthcare decision makers in making informed choice to improve the patient outcome.
Result, the cost and Kali for each drug should be considered. Cost of natalizumab is $70,024. On the other hand, we see fingolimide with the cost of $98,137. When we look for Kali, we will see that natalizumab give a higher value than fingolimide, equal to 3.01 versus 2.944 for fingolimide. ICR value was minus $1,860. So as a result, natalizumab considered the dominant drug against other option with a lower overall cost and a higher Kali production. Relapse rate for natalizumab has been found to be the most great variable that influence the model. Discount rate and time horizon and the utility change did not influence the result as much. Here we can see Tayasabri, which is the trade name of natalizumab. Tomato diagram of the comparison between natalizumab and fingolimide. In this diagram, we clarify the great influence of disease progression relapse rate for natalizumab outcome. It also shows that discount rate and time horizon and utility changes have not a great impact on the result. Holistic sensitivity analysis was developed in the comparison of natalizumab with fingolimide. In a 59.6% of the international natalizumab was dominant over fingolimide. In 1.8%, natalizumab was probably cost-effective, whereas in the remaining 34.5% of cases, it was not cost-effective. Fingolimide in the 0.5 mg presented as its trade name Gilena, which is used as an oral tab. The average difference in cost and Kali between natalizumab and fingolimide were minus $26 and $1 and $10.64, consistent with the base case. Acceptability curve for natalizumab versus fingolimide. Natalizumab has reached around 60% of acceptability curve. On the other hand, fingolimide has reached between 40 and 50%, which is a less percent compared to natalizumab.
Depend on the result of cost and Kali quality-adjusted life year, this evaluation showed that natalizumab was a dominant option against fingolimide for a high disease activity relapsing remitting multiple sclerosis treatment in patients in Colombia, with failure of first-line therapy with interferons. The sensitivity analysis also were consistent with those results. So, mean natalizumab is more cost-effectiveness than fingolimide. Critique, which include our opinion on this study. We should look for answer of these following questions. Were comparator appropriate? Was the correct type of analysis conducted? The use of cost-effectiveness analysis to compare natalizumab and fingolimide cost-effectiveness is true because natalizumab and fingolimide are two drugs of the same outcome, which is reduce the rate of relapses, but the extent to achieve this outcome is different. Through my observation of the study, it was sufficient from the point of view of the third-party payer, which include relapses rate, PML risk, mortality, utility value, and sensitivity analysis. But from the point of view of the patient or the weakness point of cost-effectiveness analysis, it's not include indirect, non-medical, indirect and intangible cost of these, who are not placed in the study.
أما بالنسبة للكريتيك فحتى احنا نسوي assess للstudy is important to consider if the cost and outcome were measured appropriately. In this study appear to have taken approach to measure both cost and outcome. طبعا هاي الميجر مال الكوست والاوتكم رح نشوفها احنا بالداتا سورس بالadjustment for inflation بالcurrency conversion بالdisease progression وحتى ممكن احنا نشوفها بالutility value. Authors did considerable difference بالcost over the time وهذا difference بالcost over the time رح نشوفها بهاي العبارة موجودة بالstudy. We adjust the report price to the present value by incrementing them by 30% according to the local health technology assessment agency guideline. طبعا الفائدة من هاي الadjustment هو to ensure the study cost measurement align with the economic context at the time and also important for accurate economic evaluation بالhealthcare.
طبعا اكو سؤال مهم لازم نجاوب عليه حتى نسوي criticism لهيجي دراسة. Were limitation addressed in this study and did the tone of the article seem biased or unbiased? The main limitation of this study is the absence of the indirect medical cost. Because MS is a chronic and degenerating disease that affects young and older people, so in my opinion, indirect medical costs and intangible costs must be included. Another limitation for this study that is the information of the study and the transition and utilities did not come from the Colombian context itself. This could adversely affect applicability of the result. ننتقل للسؤال الثاني اللي يقول Did the tone of the article seem biased or unbiased? This article seemed unbiased third-party type, which means that someone that provide an impartial opinion or decision. Providing an impartial decision on the conflict, this will increase the confidentiality of the study. بالنهاية نختم السيمينار مالتنا بمقولة تقول We had to figure out how to produce books in a cost-effective way. At the end, thank you for listening. We appreciate your time. If you have any question, feel free to ask.